Good evening. Namaste. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, and medical writer. So, on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions thrice every week regarding Ayurveda, mental health, psychotherapy, and related aspects. So, today's topic of discussion is the most trending topics or the most frequently asked topics of discussion. This is the most common mental health disorder prevalent globally. So, I think you might have guessed it right. It is depression. So, we are going to talk about depression today. So, what is depression? We are going to discuss, as depression is a very lengthy topic. We're going to break it into two or three sessions, maybe. In today's session, we are going to discuss what is depression and what is clinical depression and how is it different from normal getting depressed or getting upset or normal sadness to clinical depression, and what are the causes, what are the signs and symptoms, and what are the effects of depression on mind on and body. So let's get started without wasting any time. So depression, as we all have an idea of what is depression, but exactly what is depression? Depression is a mental health disorder characterized by persistent feelings of sadness, loss of interest in activities, changes in appetite or sleep patterns, fatigue, and difficulty concentrating. See, here in depression, there are psychological symptoms and physical symptoms as well. See, psychological symptoms is persistent feelings of sadness, loss of interest in activities. There is no interest in any activity at all. Before, they might have interest in those activities, but all the interest in those activities is lost. And if physical symptoms include changes in appetite and constant state of sadness and constant anxiety makes them feel depressed and disturbed sleep patterns as well. This may be psychological or physical. Physically also sleep is disturbed, and because of the constant sadness. And in depression, there is associated anxiety as well. Sometimes these are completely different, but still there is associated anxiety at times, and they always feel tired, that is fatigue, and difficulty in concentrating. They cannot concentrate in anything. People who are depressed, that is depression, in depression, they cannot concentrate in anything. So what happens is it significantly impacts the daily life and can lead to emotional and physical distress, and then finally may lead to suicidal thoughts or terrible thoughts like suicide and suicidal tendencies. But this is the beginning, like persistent feeling of sadness, lot of loss of interest in activities, changes in appetite, sleep patterns, fatigue, difficulty concentrating, no productive work at all, and all these impact significantly their daily life. And clinically, it is defined as, depression is a mental health condition that causes a persistent low or depressed mood swings, like loss of interest in activities that once brought joy. उनके लाइफ में पहले जिस एक्टिविटीज से उनको खुशी मिलती थी, खुशी महसूस होती थी और उनको जिसमें इंटरेस्ट था, अब उसमें उनको इंटरेस्ट नहीं होता है. कॉन्स्टेंटली दे आर डिप्रेस्ड और दे आर सैड और दे डोंट वांट टू टॉक. See, depression negatively affects how you feel, the way you think, and how you act. It Depression affects everything: how you feel, how you think, and how you act. Then it is But fortunately, depression is treatable. Depression causes feelings of sadness and loss of interest in activities you once enjoyed. It can lead to variety of emotional and physical problems, and can decrease your ability to function at work and at home. So what happens is, the impact is, it can decrease the ability to function at work and at home. So, I will briefly state what can be the depression symptoms. And the depression symptoms can vary from one person to another person. Again, it is different in different individuals. And depression has can vary from mild depression to severe. So, symptoms also in depression can vary from mild symptoms to severe symptoms. If it is treated when mild, it will not emerge into a serious or severe, major depressive disorder. So, feeling sad or having a depressed mood, this is common. Loss of interest or pleasure in activities once they enjoyed. Next, changes in the appetite. And it might also results in the changes of in the appetite is, they might constantly start eating. Yeah, they might constantly eat. That may lead to weight gain. Or they might not eat at all. That will lead to nutritional deficiency. That is, may lead to weight loss. So both can happen: weight gain and weight loss. So trouble sleeping or sleeping too much, both of these might happen. There is trouble sleep, but if once they sleep, like once they are in bed, they don't even get out of the bed. So that might also happen. And they cannot sleep at all. That might also happen. And loss of energy, or in they're always tired, they don't want to get out of the bed or get out of the room only. So increase in purposeless physical activity sometimes, and slowed movements or speech. Sometimes there is slow speech, and slow writing becomes slow, and there is slow speech. These actions are, this is severe. This can be observed by others as well. And sometimes what happens is feeling worthless or guilty, always feeling guilty or some guilty of something. And difficulty thinking, concentrating, or making decisions. So they can't concentrate, they can't you know think about something, and they cannot make some effective decisions of their life. So what happens is, in severe cases, they have thoughts of death or suicide. So there comes the thought of death or suicide. So they start avoiding friends or beloved ones. So they start avoiding people, they start avoiding social gatherings. For sometimes they feel hopeless, feeling of hopelessness. And always low energy and loss of motivation. They are not motivated at all to do anything, even to brush or take bath, in the daily activities as well. So all these things all these things combinedly happen in, some symptoms can occur in some individuals, some symptoms may not. Again, it will always differ. If you experience any of these, please consult your mental health professional, a psychotherapist or a psychiatrist. See, the difference between now, the next question you will ask me is, Aparna, I also get upset if something happens wrong. I also get sad. So what is the difference between, we all get upset about something, sometimes we all get depressed, we all get emotional, but is that depression? No, that is not depression, that is normal. then what is the difference between normal getting upset or sad, or or and the depression, the clinical depression? So the difference between the normal feelings of getting upset and clinical depression, see how we can measure is the intensity. What is the intensity, what is the duration, and what is the impact on daily functioning? See, feeling upset or sad is a natural emotional response to various life events. Suppose if my presentation doesn't go well, I might feel sad or I might feel upset, but that is temporary. As the day goes by, I am all right, and I go get back to my work, I am productive, it does not hamper my daily life, that is normal. Or some people might get upset of what is happening in their relationship, for any fight, or any fight with a friend, or any fight with your spouse, or any fight with your sibling, etc. But that is temporary, that is not, the intensity is very low, and the duration is, that is temporary, and it is not impacting your daily functioning. So what happens is, feeling upset or sad is a natural emotional response to various life events and typically fades with time. So, as I said, it fades with time. In contrast, clinical depression is a more prolonged and severe condition, that is chronic. This persists for weeks and months. In depression, the sadness or the feeling depressed or feeling low persists for weeks or months and can affect a person's ability to function. So it impacts or hampers the daily functioning at work, at school, or in relationships. It often requires professional treatment and support to manage effectively. So the intensity duration is very prolonged, it might be. So there is a need of intervention here, there is a need of professional treatment, professional counseling and support to manage effectively. So I will just elaborate. So, people ask me that many a times, that normal getting upset, what is the intensity? How can we differentiate normal getting upset and clinically depressed? So I will elaborate on this. See, normally getting upset. No, if imagine you have had an argument with a close friend or a family member, and it left you sad or upset. This leaves you sad or upset. This is a typical emotional response to a challenging situation. This is normal. Over time, with support, with understanding, by communication, you are likely to regain your emotional balance and move on from the incident. You will not keep that incident in your mind, you will just move on from that incident. That is normally getting upset or normally getting sad or depressed. See, clinical depression, on the other hand, is, let's consider a person who experiences ongoing feelings of sadness and hopelessness without any specific trigger or reason. Here in the earlier example, you had a trigger. In normal condition, you had a trigger. What was the trigger? You fought with a close friend or a family member. The fight made you upset, and you were sad for a while, and then you were okay. But here, the depression can last without having any trigger or any reason. They're depressed for nothing. So they may find it difficult to enjoy activities they once loved and struggle to maintain interest in things around them. Once they would have loved the doing, dancing or art or painting or whatever, reading, now they have lost interest in all their hobbies as well. They're not interested in anything, the people who are depressed. And these feelings persist for weeks, months, or even longer, affecting their ability to function in various areas of life. So they might start neglecting responsibilities. What happens, the impact is they start neglecting responsibilities. They withdraw from the social interactions, they don't go to social gatherings, or they don't even talk. And experience changes in the sleep and appetite are mostly affected. So when the person is in depression, sleep and appetite are mostly affected. They may sleep less, or they may sleep excessively. They may eat less or eat nothing, or they may, you know start binge eating. So, and then the next example is, if it is in a case of normally getting upset or sad, you might feel down and disappointed after a setback at work or a rejection in a relationship. See, if your presentation does not go well, or if you don't get a promotion that you are expecting, or if you don't get your prize appraisal, so, or anything of that sort, then you will have a temporary sadness. These feelings are temporary and tied to specific events. This is because you didn't your promotion, your promotion didn't happen at time, or your presentation didn't go well. There will be a social event attached to that sadness. But with time and coping mechanisms, you are likely to bounce back and regain emotional balance. That will not stop you from doing anything. It is just temporary. On the other hand, a person with clinical depression may feel an overwhelming sense of despair and worthlessness that persists even when everything seems to be going well in their life. अगर सब कुछ अच्छा भी जा रहा हो, तब भी उनको यही लगता है कि मेरे जीवन में कुछ भी अच्छा नहीं जा रहा है. There need not be a specific event. So there might be something which had happened earlier. They might also have had some promotion or job related rejection or something like that, but they will not forget that. They will not be able to bounce back from that event and regain their emotional balance. So this will persist, and if everything is going well after that, they will not feel well. Their mood is not tied to a specific situation and can present throughout the day. They will be throughout the day, their mood will be low, and they will be sad, making it challenging for them to function in their daily activities. The impact is, there is no productive functioning in the daily activities of their daily activities. So, and one more example of normally getting upset is, the loss of a loved one can lead to feelings of grief and sadness. If you lose a loved one, that may cause a grief and sadness, and you are upset and depressed for a while the when the pain is intense. When the pain naturally comes down, when you after, it is a natural process. It takes time. When you have a loss of loved one in the family, it takes time to come out of it. But after some while, after that thing is past, time passes by, people get normal, people just bounce back and are emotionally regulated. But in case of clinical depression, a person might experience prolonged and intense feelings of grief and despair even after the loss, even long after the loss occurred, like after 2 or 3 years of expiring of the loved ones, or the loss of the loved ones also. They might have this grief and upset, and they are not, they cannot come out of their grief and upset on their own. Then they they may struggle to find pleasure in anything, and may have difficulty in engaging in daily routines, so making it hard for them to cope up with life's demands. So this happens eventually. If this happens, then it is a sign to take a support from the mental health professional. Then it means that you need some support and some therapy. So It is essential to recognize that everyone experiences ups and down in life, ups and down, good days, bad days, sad days, happy days, everything. Everybody experiences all those things once or other in their lifetime. It's normal to feel upset or down from time to time. However, if these feelings, the problem is when the feelings persist for an extended period of time, that too impacting and hampering the daily life, and overall well-being is hampered. So it may be a sign of, this is a sign of clinical depression. In such cases, proper seeking professional help from a mental health professional or a mental health specialist is crucial for proper diagnosis and appropriate treatment. As soon, see, as you approach your doctor for any abdominal pain, fever, or any other physical symptoms, in the same way, if you have any health symptoms or mental symptoms, psychological symptoms or emotional symptoms, kindly approach a mental health professional as you approach a doctor for a physical problem. It is the same. So you will not be a lesser person if you approach a therapist. That mindset, we have to take it out from our mind, so that if we take that out, we can approach and we can get help at the proper time, so you don't aggravate the problem. So after this, what are the causes of depression? If you ask me, why is depression caused, then it may be because of the childhood experiences, something experienced in childhood, maybe childhood trauma or some experience they have in their past life. And in the life events, like I said, loss of a person or something, serious life events. And styles of thinking and mindset also plays an important role in the depression. See, people who have stronger mindset, they do not fall prey for depression. It is very difficult. And depression may also be a sign or symptom of any other mental health problem. So if you are suffering from any other mental health problem, this might well get attached to you as a comorbidity, and it might result from a chronic physical health problem as well. मान लो कि कोई सीरियस फिजिकल हेल्थ रिलेटेड इशू है, तो उसके वजह से भी डिप्रेशन हो सकता है. एंड डिप्रेशन में बी अ पार्ट ऑफ द फैमिली हिस्ट्री एज वेल. सो घर में किसी को पहले डिप्रेशन था, तो इट माइट कंटिन्यू इन द फैमिली एज वेल. And some drugs, medications or drugs may also cause depression. And there are so many recreational drugs, and alcohol, some types of alcohol may also lead to, excessive consumption of drugs and alcohol may also lead to depression. See, depression is a complex mental health disorder, and its causes are multifactorial. We cannot say that this is causing this or this is causing this. The factor may be multiple. There may be multiple factors causing depression. So, involving a combination of, there may be genetic, they may be biological, they may be environmental, and they may be psychological factors. So all these factors can cause, depression. It 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 is generally a combination. So genetics, how the genetics plays a role in depression. So family history plays a role in depression. How? If you have a first degree relative, a parent or a sibling or a grandparent with depression, you may have a higher risk of developing the condition. Okay. Depression might also, you may have the risk, you may develop or you may not develop. that is not compulsory, but risk is there. And next is brain chemistry. Biological is neurotransmitters such as serotonin, norepinephrine, and dopamine play a crucial role in regulating mood. See, these are called mood regulators: serotonin, norepinephrine, and dopamine. So, they play a crucial role in regulating mood. When there is an imbalance in the neurotransmitters or imbalance in these chemicals, this can also lead to depression. These are, anatomically, this is in the brain chemistry. So the it's, imbalance in serotonin, norepinephrine, or dopamine can also lead to depression. And then hormonal imbalances may also lead to depression. Changes in the hormone levels, such as during pregnancy, postpartum, there is always pregnancy related depression and postpartum depression. I think most of you might have heard of postpartum depression. Again, postpartum depression itself is a huge topic, is a major concern. So I will talk about it in some other session. But in this session, it is important to know that hormonal imbalances or menopause related depression, menopause can also influence in the mood and triggers depression in the susceptible individuals. It is not that everybody who undergoes postpartum has depression, or everybody who undergoes menopause has depression. No, it happens in only a percentage of people. So next is the environmental factors, stressful life events. See, some trauma, some accident, they might that make them disabled for life. This also can cause depression. Abuse, past life abuse, significant losses, मतलब बैक टू बैक फैमिली में कुछ लॉस हो रहा है, कोई एक्सपायर हो रहा है, तो दैट कैन ऑल्सो लीड टू डिप्रेशन. Prolonged exposure to chronic stress, if they are they are always stressed with their it might be with personal reasons, with professional reasons, or some emotional reasons. If they are constantly stressed, it can also contribute in depression. So what happens is, at times, personality and psychological factors also contribute in depression. So certain personality traits, such as low self-esteem, people with low self-esteem, that is low confidence, and people who are pessimists, who always think negatively and who always crib for anything and everything, who have low self esteem, who are pessimistic, is always thinking in a negative way that something wrong is going to happen, and who are extremely perfectionists, sometimes can be associated with a higher risk of depression. These individuals can be prey for higher risk of depression. So also, the individuals with certain psychological conditions, people who have I said that who have other psychological conditions, may also get depression as a comorbidity, like anxiety disorder. See, and if people have anxiety disorder, they are more vulnerable to developing depression. So next is a medical condition. Chronic illnesses such as diabetes, heart disease, and chronic pain can increase the risk of depression. Additionally, certain medications may have depression as a side effect. So as I said, certain medication, drugs, alcohol can also lead to depression. All these things contribute in depression. Now you will ask me, how much, what is the prevalence, incidence of depression globally? So, depression is a prevalent mental health condition worldwide. It is very prevalent and it is the most common mental health condition, depression. Its impact is significant. It affects people of all ages, all genders, and all backgrounds. It has affected people around all cultures, all countries, all socioeconomic statuses. It is not specific that, it affects only this age group, it affects only that age group. It might affect any age group or any gender. So, see, depression can affect people of all age groups from children to the elderly. It is essential to recognize and address depression in young individuals as it can impact their development and academic performances. But nowadays, in teenagers and young adults, depression is most commonly seen rather than elderly. So if we identify and if it gets treated, in the initial stages, then it is better for the development of the teenagers and their academic performance, or whatever their academic performance or work performance, or in their personal well-being, also the holistic health. Women see, some studies suggest that women are more likely to experience depression than in men. See, as I said, pregnancy related depression, postpartum related depression, menopause related depression. If we see all those things, then a slightly higher rate is in women compared to men. So, this difference could be influenced by hormonal factors, social pressures, and gender specific experiences. So, all these things are incidents. So, let's see, what are the signs and symptoms of clinical depression. What can we see in clinical depression, in the absolute, like clinical depression? What are the signs and symptoms we see in patients or in individuals who approach us for depression? See, signs and symptoms of clinical depression can vary from person to person, but they generally persist for an extended period, at least 2 weeks. If the symptoms persist for 2 weeks or more, and if it affects a person's ability to function in their daily life, then it is the time to approach a mental health professional. So what are the symptoms? Persistent sadness, feeling sad, empty, hopeless most of the day, nearly every day, and without a specific trigger or event. Then loss of interest, losing interest or pleasure in activities once enjoyed, including their hobbies, losing interest in socializing or spending time with loved ones. They don't like to spend time with loved ones. They don't like to, they avoid socializing, they avoid everything. So, changes in appetite or weight, it might be either significant weight loss or significant weight gain due to changes in appetite. And sleep disturbances like insomnia, difficulty falling asleep or staying asleep, or hypersomnia, excessive sleepiness as well. And fatigue, feeling constantly tired and lacking energy even after minimal activity. And difficulty concentrating, having trouble focusing, making decisions, or remembering things. Feeling of worthlessness or guilt, feeling worthless or excessively guilty about past actions or events. Next is irritability, being easily irritable, agitated. They'll always be easily irritated or agitated over some minor issues. And physical aches and pain, this might, result in physical aches and pain, experiencing unexplained physical symptoms, such as headaches or body aches. And suicidal thoughts, having recurring thoughts of death, suicide, or self-harm. The intensity here, it means severe. If somebody has a suicidal thought, or thoughts of death, then the intensity is severe here. Having recurring thoughts of death, suicide, or self-harm, if you or someone knows who's experiencing these thoughts, seek immediate help from a mental health professional. So, it is important to note that not everyone with depression will experience all of these symptoms. ये ज़रूरी नहीं है कि जिनको भी डिप्रेशन है उनको सारे symptoms हो, एक दो symptoms भी हो सकता है, and the severity can vary. The severity can be mild to moderate to severe, so the severity also varies. Some individuals may have typical symptoms, such as increased appetite, oversleeping, all these. Some people will have these, symptoms, uh, typical symptoms, and some people might not have typical symptoms. It is said that to a person, for him or her to get to know that they have depression or they are sad, it takes time. So depression always, to get manifested to, it actually takes time. The sooner you approach a mental health professional, the better. So it's important to note that psychosomatic symptoms do not mean the symptoms are all in the head or not real. See, psychosomatic means psycho is psychological, somatic is physical. So the symptoms, everything is not in the head in depression. So there are so many manifestation which can be seen physically. That means you can observe in your family members or in your friends as well. People can observe the symptoms. Okay, they are genuine physical manifestation influenced by emotional or psychological factors. Recognizing and addressing both the psychological and physical aspects of depression is crucial in providing comprehensive and effective treatment for individuals if affecting, experiencing clinical depression. So we have to, not only the person suffering from depression, even the surrounding people surrounding him, the family, the friends, the neighbors, whoever are close to him, can also see all those physical and psychological symptoms. So a holistic approach is required in, treatment, like psychotherapy, lifestyle changes, and mindfulness practices. I will talk about the effects of depression on body and mind, and the types of depression and management of depression. How is depression managed? So in the next session, I will talk about all these things in the coming session, that how do we manage depression, how do, what is the effect of depression on mind and body, and what are the types of depression. All these things will be discussed in the next session. So thanks for staying tuned, and that's it for today. Namaste.